So good afternoon, everyone. My name is Sam Hawgood. For those who are joining us from outside of the UCSF family, I'm Chancellor here at the University of California, San Francisco, and I'm honored to introduce United States Senator Alex Padilla and welcome everyone to today's discussion. The son of immigrants from Mexico, Senator Padilla attended Los Angeles public schools and is a graduate of the Massachusetts Institute of Technology, or MIT, where he earned a Bachelor of Science degree in mechanical engineering. Earlier this year, as you all know, Senator Padilla was appointed by Governor Gavin Newsom to finish the term of Vice President Kamala Harris. He has been a national leader and spokesperson on immigration, climate change, women's rights, and confronting the challenges posed by the public health crisis, working directly with UCSF and other top academic medical centers. These are the problems of our time. He continues to fight for sound public health policy and support the essential needs of the American people and our healthcare infrastructure. We are proud to have such a dedicated and experienced leader represent us during this pivotal moment in history, shaped by his long career serving California as the first Latino Secretary of State and formerly as a state senator. So today, we will touch on important topics such as the political dynamics in Washington, COVID-19 disparities, diversity in STEM fields, leadership, and advocacy. At the end of a conversation between myself and the senator, we will hear from Associate Dean of the UCSF School of Medicine, Dr. Alicia Fernandez, and UCSF School of Medicine student, Anuvir Singh, about their direct experience serving the community during the pandemic. They will each pose a question to Senator Padilla on behalf of you, our UCSF community. So Senator Padilla, we greatly appreciate the opportunity to learn from you today and share more about the incredible work our UCSF community does every day to advance health in the San Francisco Bay Area, Central Valley, and beyond. Our discussion is especially timely given our celebration of Hispanic Heritage Month, when we recognize the achievements and contributions of Hispanic Americans who make our nation stronger. So welcome, Senator. I'm delighted to have this opportunity to speak together. And let me begin our conversation by just stating that your service in Washington began in January, a pivotal time, not only in the COVID-19 response, but also during a very tenuous transition in our country. Despite these challenges, you eagerly got to work protecting the health of Californians and advocating for principles fundamental to who we are here at UCSF. You have certainly brought California priorities to the federal stage. And as they say, as California goes, so goes the nation. Do you think that statement still holds true? And could you reflect just a little on the transition that you personally underwent in moving from Sacramento to Washington?
Well, first of all, thank you, Chancellor Hawgood, for that very kind introduction, on point and timely, as you said. And I do want to thank everybody for joining us here today. I know there's no shortage of demands on everybody's time and attention these days, not just despite the pandemic, but maybe especially because of the COVID-19 pandemic. So I appreciate the opportunity to be with you. I'd also be remiss if I didn't congratulate Dr. David Julius, part of the UCSF family, who has just received a Nobel Prize in Medicine. So I know UCSF is proud of Dr. Julius, as is the entire state of California. So wanted to make sure that we acknowledge the research that earned Dr. Julius this important recognition. And I know he represents the excellence in innovation that defines all of UCSF. I'm proud to represent not just the community I grew up in, but all of California in the United States Senate. And as you mentioned, Chancellor, I'm the first Latino in California history to do so. So let me take a moment just to acknowledge, I think, both the opportunity and the responsibility that I have to carry my family's story and in our journey, in our experience with me every single day that I'm in the Capitol, trying to influence the work product of the United States Senate and of Congress. As you mentioned, I am a proud son of immigrants. My parents immigrated to California from Mexico in the 1960s, like so many others over the course of generations, in search of a better life, right? In pursuit of the American dream. My parents came to California specifically from different regions in Mexico. They didn't come together. They actually met in Los Angeles. My father was from the state of Jalisco, my mom from the state of Chihuahua. They arrived with little formal education, but with tremendous work ethics and big dreams. You know, they met in Los Angeles, got married, started a family. And for 40 years, my father helped provide by working as a short order cook, right? So if you've ever been to a diner, imagine who's scrambling eggs and flipping pancakes. That's what my dad did for 40 years. For the same 40 years, my mother used to work cleaning houses in some of the wealthier communities in Los Angeles. On those modest incomes, they're proud of the hard work, but honest work that they did. They raised three of us. They have an older sister who has been a teacher's assistant. She's been a teacher. She's been an assistant principal. She's been a principal. She now works in administration for the Los Angeles Unified School District. My younger brother is currently chief of staff to the current city council president in Los Angeles, Nuri Martinez. And, I mentioned their career trajectory because frankly, it's not a coincidence. We're all in public service. I just happen to be a middle child. That probably explains a lot. Makes an occasional headline. But we're all in public service because of my parents' emphasis on, number one, getting a good education and constantly finding ways to serve others. And especially that getting a good education, part of an opportunity that my parents did not have, but they knew was key to achieving a better life, is what led me to do well enough in my studies, even though I was by far not a straight A student, did well enough to inspire me to apply and be accepted to the Massachusetts Institute of Technology. So I did spend 4 winters in Massachusetts, earning my mechanical engineering degree. And it was, returning from MIT in 1994 that my life took a turn. In the year 1994, those of you old enough to remember, the political climate in California was very different than it is today. There was a measure on the ballot that November known as Proposition 187, similar to what we have seen in later years in Arizona and Texas and elsewhere. It was immigrant scapegoating, anti-Latino rhetoric, that convinced me to pursue a career in government and politics, to do my part to change the trajectory of the state of California, because I knew at the time that what I was hearing through political ads did not respect the values that I was raised with and that I knew that Californians believed in. So with an engineering degree in hand, a STEM background, but a young man of color, I knew that I needed to do my part in the electoral political world to make a difference. And I think that upbringing and an engineering career certainly gives me a unique perspective. It was helpful and unique from my time as a staffer, campaign manager, to the time I ran for city council in Los Angeles once upon a time, as a state senator, secretary of state, and certainly now as a United States senator, bringing that perspective, that experience to fight on behalf of so many working class communities across California, like the one where I grew up. So, just wanted to share a little bit of that background before getting into the question at hand, which is, what does that mean for the issues, the priorities now, and how I'm going about my work, trying to impact the work product of the United States Senate, but representing California in that process. A lot of issues to talk about, but I think none more pressing, none more urgent, none more consequential than our response to the COVID-19 pandemic. I got to say, I'm thankful for the leadership of UCSF in helping, not just generally speaking, but specifically the underserved and more impacted communities in their effort to access critical care during the pandemic, accessing testing and vaccinations. That's exactly what we have to do, be data-driven in how we confront the most significant challenges of our time. I think you especially have shown the whole world the courage and strength of our nation's frontline healthcare workers, because now's the time for not just California, but the nation to step up and support institutions like UCSF as you rise to meet the challenge of the pandemic and move towards recovery. We have a unique opportunity to not just recover from the pandemic through vaccines, but rebuild an economy from a fundamental standpoint, of rebuild an economy in a way that's stronger, more resilient, and more equitable than what we had prior to the pandemic. Because prior to the pandemic, we still had so many inequities and social issues to confront. So right now, Congress is working to pass a generational investment in America's infrastructure. Now, I want to make sure that California doesn't just get its fair share, but that we're thoughtful, strategic, and equitable in the investments that we are about to make. You've heard the debate publicly about investing in transportation versus water infrastructure versus the electrical grid versus broadband deployment, and why investing in what some have labeled human infrastructure is even necessary. Look, housing affordability, homelessness, yes, that drives home the point why housing is critical infrastructure and in dire need of investment. The education gap prior to the pandemic, Zoom school, not easy for anybody. All the more reason to invest in education to close those gaps is critical for the future of our nation. The care economy, et cetera. But if we've learned nothing else from this pandemic, it's the need to invest in our healthcare infrastructure at all levels, to modernize healthcare as we know it, expand capacity for a growing population, and to prepare more medical professionals to serve well into our future. We know that the last year and a half has not been easy for medical professionals serving on the front lines. Devastating health impacts, devastating mental health impacts. We need to recognize that and work towards a full recovery for all Californians while we address the inequities in healthcare and social services that COVID has highlighted and exacerbated. So just kind of want to give one example. I recently introduced the Patch Act in Congress to increase funding for pediatric hospitals, which help some of our most vulnerable children access life-saving care. So it's working in partnership with UCSF and other entities throughout California has given me the insight and I think preparation to try to hit the ground running to the best of my ability here in the United States Senate. You heard all about the American Rescue Plan earlier this year. We're looking forward to part 2 of the infrastructure efforts here through the budget reconciliation process. I know it's a technical term, but I think it's going to really pave the way for unprecedented and much needed investments in our nation's infrastructure, in working families across the country, and driven by that technical background and the experience of growing up in California. I hope helps inform me to be the best advocate and representative I can as we work to battle climate change, reform our immigration system, protect voting rights, and so much more. So just again, I want to thank you for the opportunity to be with all of you today, and look forward to responding to some of your questions.
Great. Well, you've touched on so many important issues there, but I'll just make a comment. You said you were not the best student. You were being overly humble. Someone that graduates from MIT with an engineering degree is a superb student. So, but you touched on so many issues, and thank you for your support and introduction of the Patch Act. As you know, where we have experienced during the pandemic and really before the pandemic, the need to modernize our hospitals here at UCSF. And so we're embarking on a very ambitious program, both here in San Francisco with our adult hospital and in Oakland, where we have a wonderful children's safety net hospital. and we'll be rebuilding both of those facilities over the next few years. So we hope we can work with you closely to make sure we're successful in that, and particularly address some of the mental health issues for children that are truly underserved in our communities. One question for you is, you mentioned the healthcare workforce have been very strained and stressed over the last 2 years, and that is putting stress on the workforce now as people are out of work, either because of COVID or COVID in their families, or just feeling that they've been so overworked in the last couple of years that they're looking at other career paths. So we need to rebuild, and we need to rebuild with more diversity and more opportunities for people of color. We're embarking on the journey, which will be a long journey, to a new medical school in the Central Valley in collaboration with UC Merced. But can you comment on some ideas that you might have as to how we can best address what you called out as a lack of opportunities for community of color to join the healthcare workforce? Any strategies that you would suggest we pursue?
Yeah, well, I mean, I think beginning by recognizing that if it was easy, it'd be done already. Right, but it's not easy. It is hard, but it is critically important. So first step is acknowledging it. Number one, I recall when I was in the state legislature, when the Affordable Care Act was passed, California had the foresight to know that if we're expanding coverage and access to care, we need to expand the workforce at all levels. Not just medical doctors and nurses, but all the way throughout, to truly meet the needs of California's population. And by extension, I think it's a lesson for the entire nation. So as we're continuing to do so because of the COVID pandemic, then it's not just how many more nurses we can recruit or X-ray technicians, and you fill out all the categories, but doing so with an eye towards cultural competency, linguistic competency. California is the most populous state in the nation, but also the most diverse state in the nation. And so achieving the workforce that we need in the healthcare space while doing so in that responsible manner requires us to reach into communities that have too often been ignored in the past. But I'm hopeful because it's a lens that not just I bring to this particular job, but I've heard from President Biden, from Vice President Harris, so many times. I haven't heard a presidential administration in the past use the terms equity, diversity, and inclusion in every aspect as much as I've heard this administration. So it's really taking up the spirit and the vision that they've laid out, whether it's in transportation, education, job opportunities, but healthcare is a question at hand here to do so. So reaching into community colleges that have been outreached to in the past, even high schools and middle schools in communities throughout the state. So I think the potential is absolutely there. We just have to be mindful of it and help execute.
Apologize for the background noise, but speaking of children's health, we have a helicopter landing on our children's hospital right outside my window and taking off. I was speaking to someone earlier this morning about the comparisons between the 1918 pandemic and the current COVID pandemic, and reflecting on the fact that it took till 1950 to develop the first vaccine against the influenza virus that caused the 1918 pandemic. But here we are now, almost 2 years in, but we've enjoyed the tremendous success of a vaccine that was available to us in December. And that shows the power of science, obviously one of UCSF's strengths. And I actually thank the bipartisan support of the NIH and other federal scientific agencies. But any thoughts on how we can continue to partner with you and your colleagues in the national government to make sure that the science that we're doing is relevant, and we can improve the scientific literacy of the community so people understand that science is indeed a path forward and not a threatening issue for them to be concerned about?
Right. Well, I think a couple things come to mind. One, as one of the few engineers and scientists working in the Senate, I again appreciate the fundamental research that's done and the partnership opportunities. Exhibit A is scientific contributions to tackling the COVID pandemic. You know, to think that in less than a year, multiple vaccines were developed, not just one, and such a rampant upscaling of manufacturing, you know, so generating the supply, distribution, and administration of the vaccines. Incredible compared to the prior major pandemic of 1918. By the way, side note, when I was still Secretary of State, we started a project to capture and document people's experience of the COVID-19 pandemic. We have records of what life was like for so many during the pandemic of 1918, 1920, going forward, for use in future for future researchers, because we know that there will be another pandemic at some point, and the more we capture our experience, the more we can help inform a response to future pandemics. Now, that being said, I think we do have a challenge that we have to address collectively, and that is the challenge of misinformation and disinformation. It's something I battled when I was California Secretary of State in the election space. I mean, it doesn't take much to just watch the news and know that our fundamental democratic institutions are being challenged by a lot of disinformation, not just, but especially online, when people are questioning certified election results. We know that we're not in a good space. But we saw it also last year during the 2020 census. So many of us partnered together to try to promote census participation, not just for purposes of reapportionment and redistricting, but because of what it meant for important federal funding, including healthcare funds, coming to each and every community. When that is challenged because of misinformation and disinformation tactics, that is harmful. And now we're seeing it when it comes to the vaccine. You know, I think most people, when they hear it and they hear it from voices that they trust, know, talk to a doctor, talk to a medical professional. They'll tell you the truth about the vaccine. They'll tell you the truth that COVID is not a hoax, it is real. And you can't trust the vaccine. It is safe, it is effective, it's free, those sorts of things. That's how we're going to continue to make more progress, because as much as we've been successful compared to 1918, you know, how many Californians have been vaccinated is nothing short of a miracle, but we know there's still a significant population that hasn't been vaccinated and is questioning or resistant to the scientific evidence and the scientific advice. So we need to continue to put maybe not politicians, maybe we're not the best message carriers, but more trustworthy people like doctors and nurses and other medical professionals in the communities that need to be hearing this.
Great, thank you. I'm proud to see that this morning I get the daily information from our 33,000 members of the UCSF family, and we are at 99.2% compliant with our mandatory vaccination policy this morning. So it's remarkable to see how engaged our community is here in the Bay Area. I'm going to ask you one last question, and then I'm going to turn to two colleagues to continue the conversation. In the state, when you're in Sacramento as a state senator, you passed landmark legislation to combat climate change. We at UCSF are very focused on the health impacts of climate change. How are you seeing the climate of climate change reform in the federal government?
Yeah, it's mixed, to be honest. I mean, I think there's certainly the challenge of those who deny the science of climate change. That's very real and palpable, and a big reason why, as a nation, we haven't done more to combat climate change. But I think we're getting there. Give you one example, and this is not from a colleague on the other side of the aisle. This is another fellow Democrat, but several weeks ago, when the fires were at their maybe peak, prior to the peak in Northern California, talking to Senator Dick Durbin from Illinois, because when the skies are smoky in Chicago because of the fires in California, we know that it's not just a California issue, right? And wildfires aren't just about wildfires. It is a reflection that climate change is real. When we hear reports of, oh, if we don't do anything now, then in 25 years, the planet's temperature will rise on average of 1.5 degrees. Yeah, that's in 25 years, but climate change is having an impact now. More recently, we saw another record hurricane hit the Gulf Coast and what it meant for those communities there. All of a sudden, my colleagues in Louisiana who are across the aisle are receptive to a conversation. Flooding in the Northeast, et cetera. But I think the most hopeful story I can share with you is this. Earlier this year, if you recall, the electrical grid in Texas was impacted and frankly went out of commission in many parts because of ice storms, not wildfires, but ice storms in Texas. And so I took that as a moment of opportunity to reach out to my colleagues from Texas and say, look, we don't have to be divisive about this or overly partisan. Let's just look at the facts. The power's out in Texas because of the state of the electrical grid. I think if we bring some federal resources and expertise to bear, what if we worked with state and local governments and utilities to invest in the electrical grid for the sake of not just reliability, but resiliency? Imagine through grid modernization, we can also make the grid more efficient and reduce emissions in the process and do our part in improving the environment. And we made progress, and this was the deal, as long as we didn't put climate change in the title, for better and for worse. For some people, just the terminology becomes polarizing or it just have a negative reaction. And so with the engineer in me, I just want to be effective here. Let's get the language right. Let's get the substance and the policy right. And we'll label it something different. So we came up with a Power On Act. Okay, we can market that, but let's get the policy right. And that was quickly included in the bipartisan infrastructure package, which the Senate approved in August. So there is hope. Sadly, if it takes record-breaking wildfires or ice storms or hurricanes to get that movement, it shouldn't take that, but utilizing some of these emergencies to make progress because our planet depends on it.
Great. Well, that's spoken just like a great engineer. Let's find the practical solution to the problem and move on. Right. So let me ask my two colleagues, Alicia Fernandez and Anuvir Singh, to join us on the screen now. I'll very briefly introduce them because I want mainly their time for a dialogue with you. Alicia is a professor of medicine and an associate dean of population health and health equity. She's an internist at Zuckerberg San Francisco General Hospital, the safety net hospital here in San Francisco. And importantly, she is the founding director of the UCSF Latinx Center of Excellence. And Anuvir Singh is a medical student, and he's in a particular program in our medical school pathway that is called the UCSF Program in Medical Education for the Urban Underserved. And it promotes additional training in health equity and healthcare for urban underserved communities. So I'll first turn it over to Alicia to ask you a question, and then we'll go to Anu.
Thank you, Chancellor Hawgood. Senator Padilla, let me start by thanking you for your efforts on behalf of all Californians to promote a healthier and more inclusive society. As you know, COVID-19's impact in California was more severe in communities of color, and UCSF faculty, staff, and students stepped up and partnered with community groups to provide education, testing, and vaccination in hard-hit communities in San Francisco and in Oakland. And we're proud of this work and enormously appreciative of the support from the Chancellor's office that enabled it. Now, research done by our colleagues in the Department of Epidemiology and Biostatistics found that throughout the state, excess deaths from the pandemic were highest in immigrant Latinos. The farm workers, food workers, warehouse workers, other essential workers and their families, all were the most affected. And as you so deeply understand, COVID prevention and healthcare, as well as COVID economic support and recovery are much more complicated for immigrants, particularly those who are undocumented or in mixed status families. And this may be even more the case in other parts of the country. So my question, Senator, is what can you share with us about prospects in this Congress for a pathway to lawful permanent residence or for formal protection for millions? Thank you.
No, like it's a great, timely question, one that's personal to me, given my family's journey, right? I'm a proud son of immigrants, and also critical to California. We're the most populous state in the nation. We're also the most diverse state in the nation and home to more immigrants than any state in the nation. So no state has more at stake in this than California. Again, bringing that to state priority and personal experience to the conversation here in the Senate. Part of a bipartisan work trying to advance immigration reform, a lot of one-on-one conversations. I'm going to get to these in a second, but also trying to be strategic in how do we find a way forward? Is it through regular legislation and the regular process, which is far from efficient in the United States Senate, or are there other ways? And so our most recent priority has been to try to include it in the budget reconciliation process, right? Part two of this infrastructure negotiation under what I think is a very solid argument. The economic contributions of immigrants to the country is hugely significant, and by extension to the federal budget. So if the budget reconciliation process is what we're talking about, yes, it's more than appropriate to advance some immigration policy through the reconciliation process. I won't bore you with, it's a 50-50 Senate, so it makes it harder. The filibuster 60 vote threshold makes it even harder, and appealing to the parliamentarians to meet the criteria of the budget reconciliation process, et cetera. All that being said, I think we're partly making headway is kind of really breaking it down. I don't know if it's because of less of an understanding that should be the case, less of a recognition that should be the case, or it's just political excuse. A lot of my Republican colleagues behind closed doors will say, "Oh no, I'm for immigration reform, or I'm for the dreamers, or I'm for protecting farm workers or other essential workers." That's the content of my first bill. But we've got to get the situation under control at the southern border, right? We saw earlier the year the increase in the number of migrants seeking asylum in the United States. More recently, we saw thousands of people from Haiti seeking refuge in the United States at the southern border. That's something important that we need to address, but it's a very different population than the millions and millions of people who have been here for years, not just dreamers. Undocumented adults in the United States have been here on average 18 years. Yes, data is important. 18 years of working, paying taxes, buying homes, raising families, contributing to the success of communities and to our economy. Let's not let this be an excuse for not doing justice by another population. As I've been sharing kind of just those basics with a lot of my colleagues, I do feel a little bit of a difference in how issues are being approached. So, I'm optimistic, hopeful that we'll see some progress this year, providing that security to be able to live without fear of deportation for the people who have earned it, particularly during the pandemic, right? More than 5 million undocumented immigrants now considered essential workers by the federal government of the United States of America because they're in healthcare, because they're in the fields, meat processing, construction, transportation, grocery stores, and more. So if we call them heroes at 4 o'clock and, clap and post and tweet about them, then we need to treat them as such if those words are going to be genuine. So, stay tuned. I do hope to have some significant news here in the next few weeks.
Great. I'll make just one quick follow-up comment, and then I'll turn it over to Anuvir to close it out with his question. In support of Congress and the administration, at least we hope in support, to developing more humane immigration policy, UCSF created the Health and Human Rights Initiative that's focused on delivering timely forensic medical reports of torture or persecution that we hope will allow the US to reduce backlogs and reunite families. It's a fairly new initiative, but we'd love to follow up with you if you think it can be of any help in your work. So let me now turn it over to Anuvir to ask his question. And we do have a hard stop at 5:45, but go ahead, Anu.
Hello, Senator. My name is Anuvir, and it is my pleasure to share this space with you. I'm a fourth-year medical student, part of the PRIME program at UCSF. And as we know, COVID-19 has exposed and amplified long-standing inequities in our society. There's heightened awareness to the importance of workplace protections for essential workers. My father is a farm worker in Fresno County, and inspired by his experience, I have conducted research on farm worker access to life-saving information and equipment during the pandemic. I have personally witnessed how my father and his coworkers have not had access to PPE or other safety protections during this time. So I have observed how legislatively mandated health and safety measures such as providing PPE to the farm worker community is well-intentioned in policy, but it's not always implemented in practice. So my question is twofold. One, how can we ensure that legislatively mandated policies have a desired impact on protecting the communities that they're intended to help? And similarly, given the ongoing risks of COVID-19 and climate crisis, how can the federal government reinvest in workplace safety and ensure protections for those who are supplying our nation's food and other essential services?
Yeah. No, great, and obviously timely questions. So a couple of pieces, and I'll try to be quick because of our time. Number one, I'll call your attention to a recent announcement by the White House on their work in the space of extreme heat conditions and better protections for workers. You mentioned farm workers. We know that in the Central Valley in the summertime, it's extreme heat in addition to COVID these days. That is a significant threat. So California has led the way on protections and safeguards for workers in extreme heat conditions, both outdoors and indoors. And I think it's a tremendous model for, I think, the rest of the nation to follow. But to your question about policies or legislation that's passed and enacted, but not always implemented. Enforcement and oversight is hugely critical. A lot of people who get involved in advocacy work think, well, the bill got introduced, that's a milestone, or the bill got passed, that's a milestone. The bill got signed, that's a milestone. Clearly, we're learning that that's not enough. We've got to stay engaged through successful implementation of a lot of the ideas that we fight for. So there's just as much advocacy work in the executive branch through departments and agencies that's critical. So when the governor signs a bill, that doesn't mean the fight is over. That just means we move on to the next stage. So that's one that I think a lot of people should learn more about and engage more in. And the other is, it doesn't mean we can't go back to the legislature. One of the important roles of legislatures at the federal level and at the state level and even at the local level is oversight. So working with representatives, key committees to schedule hearings on precisely these topics, right? The California legislature technically is no longer in session. It means that they can't introduce or entertain bills for the year, but that doesn't keep a policy committee from conducting hearings, whether it's in the Capitol or field hearings elsewhere in California on issues like this, to do the fact finding, build the body of evidence to go back in January and maybe pursue additional legislation, leverage the budget process for accountability in departments and agencies. There's a lot of ways to continue to hold government accountable, again, long after a governor has signed a piece of legislation or a president has signed a piece of legislation.
Great. Well, thank you. And thank you for that advice to focus as much on implementation advocacy as on legislative advocacy and policy. So Senator Padilla, thank you so much for joining us today. I know you're a very, very busy man. You have a little problem of the national debt to deal with, I hope, tonight. But we really appreciate you taking time out of your busy schedule to talk to us this afternoon. And for those listening to the webinar, thank you for being here. These conversations are crucial to our work at UCSF. To everyone watching, if you want to learn more about how policy impacts the work we do at UCSF, please join our UCSF advocacy program at ucsf.edu/advocacy. With that, I thank you all for joining us. Senator, particularly you, Alicia and Anu, thank you for contributing. Goodbye, everyone, and have a great night.
Thank you. Stay safe, everybody.
Thank you.